If you want to learn the secret treatments behind next level female attraction, keep watching. I'm going to share everything I did on this patient, but I want to share this concept because it's key to understanding why we do the treatments we do. A scientist studying attraction analyzed variations in female facial features and discovered that one of the key features that separates an attractive female face from a very attractive or stunningly attractive female face lies in the concept of hyperfemininity. Hyperfemininity is very powerful. And just to show you how powerful it is, ask yourself why so many women cross-culturally wear makeup. Makeup amplifies feminine features. Women get lash extensions, wigs, hair extensions. Why are plastic surgery procedures like breast augmentations, BBLs, and brow lifts so popular? These procedures in particular serve to feminize the face and body, and injectable treatments like Botox filler or collagen stimulators can also enhance femininity, and I'm going to share how you can maximize your attraction, and I'll also share some other ways you can enhance your feminine beauty that have nothing to do with injectables. What is hyperfemininity? Hyperfemininity in facial features refers to exaggerated characteristics typically associated with femininity, and it all begins in puberty. Sex hormones cause the body to undergo a metamorphosis, leading to distinct facial and body shape differences between males and females. The hormone estrogen causes females to have higher brows, more fat around their cheeks, fuller lips, a shorter and narrower lower jaw, and more fat distribution around the breast, hips, and thighs, leading to more of an hourglass shape. Female faces and bodies that display hyperfemininity are attractive because they signal that they have an abundant supply of estrogen. They project maximum fertility cues. Hormones are incredibly powerful, and they don't just have an effect on our mood. They shape our faces and bodies. Estrogen can literally change the size of your breasts throughout your cycle. Ever notice how some days you look in the mirror and you feel beautiful, but other days not so much? It could be tied to where you were in your menstrual cycle. Studies have shown that women are most attractive during the fertile phase of their cycle. When female or male bodybuilders use testosterone, it can deepen their voice. Or if bodybuilders are doing growth hormone, it can have an effect on their face and enlarge their facial bones. The most striking yet interesting example of someone who had a naturally hyper-feminine face is Brook Shields from the late 70s and 80s. She was renowned as one of the most strikingly beautiful stars of that era. During her childhood and early teenage years, her face epitomized hyperfemininity. However, as she reached her late teenage years to early adulthood, her facial features evolved significantly. Her nose, eyes, and lips remained relatively unchanged, but her facial bones enlarged. Her brow bone became more prominent and her jawline broadened. Despite these changes, she's still beautiful. But a lot of people, including myself, find the shift and transformation of her facial features really surprising because you don't typically see a change this drastic from puberty to early adulthood. Comment below and let me know if you agree that these changes are surprising. Have your features drastically changed from when you were a teenager to now? Here are some other examples of hyperfeminine looking women, and there are many, many more celebrities we could have shown. These are just a few, but one of the best celebrity examples of someone who dramatically amped up her femininity is Sophia Richie. Sophia has most likely done a number of non-surgical and surgical procedures to achieve this hyperfeminine look. Her forehead looks to have been elongated, and this can be achieved with removing some of the hair at the hairline with laser hair removal. Rita Hayworth was rumored to have done this with electrolysis back in the day in order to achieve a higher hairline. So why would someone do this? Well, the shorter your forehead, the more it will emphasize your brow bone, and men typically have a more prominent brow bone than women. So when a forehead is shorter, it can give the face a stronger, more masculine appearance. And just how powerful are brow bones and hairlines when it comes to femininity? Well, around 90% of transgender women who seek facial feminization surgery get procedures to shave down their brow bones to make it less prominent. And they also get brow lifts to lift the brows to a more arched feminine position. I'm covering up the upper and middle parts of these three women's faces, and I want you to tell me which upper face looks more feminine. Most people would say the photo on the right looks more feminine. The foreheads are just as high, but the hairline is shaped differently. Men tend to have hairlines that are more M-shaped, and women's hairlines are more round. Also notice what's happening with the brows. you can see the face on the right has a slightly higher brow position than the other two. So the position of the brow is very important when it comes to looking feminine.
This is why a lot of women and celebrities get endoscopic brow lifts.
Also notice what's happening with the shape of the eyebrows. In the upper face of the woman who looks more feminine, her eyebrow hairs are thinner and the tail of her brow has more arch. Looking at this helps explain why a lot of women will take grooming their eyebrows very seriously.
So for women with a lower brow position, if they have very thick, bushy eyebrows, it's probably more important for those women to groom them to make them thinner and give them more of an arch, because the thinner your brows, the more space in between your eyelid and brow bone. So eyebrow shaping can make your brows look higher.
Another procedure Sophia likely underwent was one or more nose jobs. Her nasal tip changed from a flatter shape to a straighter, more contoured one, making her nose appear more delicate, which softened her features. And just to mention, you don't always have to go under the knife to tweak your nose. Some people may be good candidates for a liquid rhinoplasty, which is done with fillers. Although in Sophia's case, using filler would not have resulted in this look, because in order to actually reduce the size of your nose, you need surgery. And when you use filler, you're adding to the nose. So it's ideal for someone who wants to make small tweaks, but it cannot make your nose smaller. Sophia also always had a nicely defined jawline, which she inherited from her mom. And as we've mentioned in other videos, defined jawlines are desirable in men and women. But with women, even if the jawline is slightly bulky, it can make the face have a more masculine appearance. Let's look at the three variations of the woman's faces again. Most would say that the photo on the right is most attractive, and one of the main things they did here was to shorten and narrow her jawline. And it looks like Sophia may have treated her masseter muscles on the back sides of her jawline with Botox to slim her jawline. And this is a very popular treatment that women do as opposed to men. It looks like she may have also had a very nice natural looking lip filler enhancement. Fuller lips are associated with femininity because it's correlated with higher levels of estrogen. This is why women generally have fuller lips than men, within their race or ancestry, that is. Lips are extremely potent sexual symbols of feminine beauty, so enhancing them with filler, if it's a natural looking enhancement, can make them enticing and evoke a sense of allure, desirability, and sensuality.
People may not realize it, but this is precisely why lip filler is the most popular area to treat with filler. I recently did a video on how filler overall is declining and how it's become a lot less popular. Well, lip filler isn't going anywhere, and I predict it will only continue to increase in popularity as more women, and in some cases men, realize just how it can enhance your beauty and desirability.
As for her body, Sophia appears to have undergone two of the most sought-after plastic surgery procedures women get. It looks like she may have had a Brazilian butt lift or BBL, where fat is typically removed from the waistline through liposuction and transferred to the buttocks, creating a fuller, rounder shape, which can give a more hourglass figure. And she may have also had breast implants. These two procedures can significantly amplify sexual attraction because they mimic the effects of what estrogen do on a woman's body. BBLs and breast implants are among the most popular cosmetic surgeries worldwide.
Now, Sophia may have done even more surgical procedures. It's possible she may have done a chin reduction and an endoscopic brow lift. It's possible.
Isa Gonzalez is another great example of someone who maximized her attraction and achieved this hyper-feminine look.
So how can we use non-surgical, non-invasive treatments to achieve that hyper-feminine look? I'm going to show you how I customize treatments to maximize her attraction.
Her face displayed beautiful femininity already. She has open eyes because she has a high brow position and a defined eyelid crease. She also has full cheeks and a pretty full lip size. So how did we enhance her feminine features even more? We did Botox to her glabella, forehead, and crow's feet. This reduced her fine lines and softened the appearance of her skin, and neuromodulators, because they temporarily weaken the muscles, can make the facial expressions more gentle. We also did filler to her lips, which she requested, even though she has full lips already. Enlarging them can make them look even more feminine and alluring as long as you keep it looking natural. And we also did filler to her smile lines or nasolabial folds, which helps soften her lines, and we used a total of 1 syringe for both of these areas. One of the most significant treatments we did was treating her masseter muscles with Botox, which slightly reduced the width of her lower face and gave her jawline a more delicate feminine contour. She also grinded, which is when you unconsciously clench her teeth, and that can be when you're awake or, in her case, during sleep. So treating her masseter muscles with Botox helped alleviate this grinding, which is also known as bruxism. We also enhanced her profile by doing chin filler, which projected her chin a little bit more forward, and this helped balance her profile. As we get older, we lose volume to our faces, especially for those who fall into the facial aging category of sinker. When we're younger, our faces have more softness because we have more facial fat and collagen. In this patient, we treated her temples and her cheeks with Sculptra, and Sculptra also improved this area that was hollow. And this was only after 2 vials, and it helped bring back some of that youthful feminine softness. You can see her face showed more underlying bone structure before.
Even if you were born with feminine features, or let's say you have this hyper feminine look already, at some point you're likely going to have to get treatments done to maintain your look because you're going to age, and facial aging is definitely going to take a toll on your attraction. Also, every person, woman or man, is going to be different as to how you enhance their attraction. But I can tell you that when it comes to women who maximize their attraction, they are investing in themselves. And this doesn't necessarily mean investing in injectable treatments like the ones I've shown you. You can invest in yourself in many other ways that have nothing to do with injectables. You can work out to stay fit, you can eat healthy food and consume healthy quantities of food to maintain an optimal healthy weight. And this is paramount to maintaining your most attractive look. And this is why a lot of people are on Ozempic. You don't need Ozempic to lose weight, and I think it's best to lose weight without these types of drugs. But I reside in LA, and in Los Angeles and other cities, they're hubs that highly value appearance. Well, the rumor is that a lot of people here in LA are on Ozempic or other semaglutides, or they're microdosing on these medications. Also, a lot of women who want to maximize their femininity tend to have hair that's healthy, and they have a hair length that's on the longer side because long hair is generally seen as more feminine, and hair is our biggest accessory, and it can dramatically impact our appearance. If I could tell you the top ways that I've enhanced my feminine look with injectables, it would be 2 main things. One, Sculptra, which I talk a lot about in my videos. I'm a big fan of Sculptra because it kind of changed the game for me because I am very lean and I also love to exercise and I do cardio and weights, and I like to keep my weight in a very strict range. And that's great for the body, but it doesn't look great on the face. So after a certain age, you start to really see it. What I noticed was that my face started getting kind of gaunt in areas like the preauricular, submalar, and temple regions. And this is also probably because I dropped maybe around 10 to 12 pounds. And on someone my size, you would see that on the face. So Sculptra really changed the game for me because it stimulates your skin to produce its own collagen and it thickens your skin, so it brought back that youthful softness. There's actually a famous saying, it's a quote by the French actress Catherine Deneuve, and she said, at a certain point, a woman has to choose between her fanny or her face. Well, the thing I love about injectables, especially collagen stimulators like Sculptra, is that I don't have to choose between my body or my face. I can have both. Another thing that enhanced my feminine look was I naturally have large, full lips. I've had large, full lips before full lips were a thing. And I know a lot of people don't believe me. I get a lot of comments on my channel saying, your lips are overdone with lip filler. I have never injected my lips with filler. Ever. But what I have done is the Botox lip flip. It just gave my lips a little bit more of an enhancement at the Cupid's bow because it flips it up. It's subtle, but it's all about the fine details. One thing that I've always said about lip flips are that they work really well for people who have medium to full size lips. If you have lips that are on the smaller side, you may benefit more from getting a lip enhancement with filler. And you don't have to use Botox, by the way, to do a lip flip. You can use other neuromodulators like Dysport, Daxify, Juvo, or Xeomin. And if you want to find out if you're a good candidate for the lip flip or lip filler or both, be sure to check this video out after. And if you want more tailored advice on how you can enhance your look, I do offer virtual cosmetic consults, which you can schedule on my website. I love helping people maximize their attraction because beauty is power. When we feel more beautiful, we feel better about ourselves. And if you want more general advice on how you can look more naturally beautiful, make sure you check these videos out.